I've seen a lot of deaths, especially among children. 1 out of 100 children in Gaza have been killed, which is the equivalent of 500,000 American children being killed in 6 months. This is unprecedented, this is catastrophic, and it should stop.
Dr. Sahloul, talking about the impact on children, just tell us more about the physical brunt of this that they're bearing. A lot of children losing limbs if they don't lose their lives, and then the mental toll here as well, so many children being orphaned as well.
Yeah, I mean, as we know, now there's an additional problem, which is the acute malnutrition among children. 1/3 of the children in Gaza have acute malnutrition, which will lead to irreversible impact on your physical and mental health and development of the children in Gaza. That means they will suffer for a few decades because of what's happening right now in Gaza. When I said that 73,000 people have been injured, most of them are children. Half of them have moderate to severe injuries. That means they will have some type of disability, physical disability, for the rest of their lives in Gaza. And you can, of course, imagine the mental health trauma of these children. I've seen in the clinic children so traumatized because of the sounds of explosions that happens every night. And many of them, manifestate that with physical illness and pain. One of the children that I've seen in one of the displacement centers, his name is Abdullah. I ask every children in Gaza, what would you like to be in the future? And they say doctors. They like to be doctors in the future, not martyrs or fighters. Except for one child, I saw him, and he had typical PTSD on his face. I asked him, what would you like to be in the future? And he said, what future? So I think it's very important for us to make sure that these children in Gaza, the 1.1 million children in Gaza, who many of them lost their lives and they had nothing to do with October 7th, have a future. It is our responsibility as humanitarians, as Western countries that can influence the situation. And that's what I shared with President Biden when I met with him three weeks ago in the White House, that his legacy will be determined by what he does in Gaza.
And talking about those doctors and nurses who you said were overwhelmed there, I mean, we know under international humanitarian law, they should be protected under the Geneva Conventions. Is that being upheld?
Definitely not. When we see 75% of the hospitals and the clinics stop working, many of them have been destroyed. Oxygen generators being bombed, incubators stop working because of lack of electricity, patients dying because of lack of medical supplies and medications. The main tertiary centers in Gaza, Al-Shifa Hospital, that treats 750,000 people every year and has more than 25,000 surgery every year, and Nasser Hospital are not working. That means many patients with chronic illness, as in your report, will die unnecessarily. Patients with chronic kidney disease, patients with heart disease, patients with cancer, children who are suffering from malnutrition, women who are bleeding after delivery, all of them will not have access to health care. And what we are seeing in Gaza is unprecedented in terms of the systematic attack on health care.
Mm-hmm. Dr. Zaher Sahloul, President of MedGlobal, thank you so much and for coming on and bringing us that perspective there from the ground. We appreciate it.